Thank you all for joining us. This is the first meeting, this session for the subcommittee, so we'll do some brief introductions. And to my far right, I will start with the esteemed Chair of Education and Health.
Good afternoon. I'm Ghazala Hashmi, representing the 10th Senatorial District and joining you today as ex officio. Thank you.
Thank you, Madam Chair. I'm Senator Barbara Favola, and my Senate district is completely contained within Arlington County based on the new redraw. So I give up Fairfax and Loudoun, but I'm delighted to be here and happy to start a new session.
I'm David Suderline. I have the honor of getting to represent Roanoke City, Salem, most of Roanoke County, and most of Montgomery County. So I have perhaps the highest concentration of health professionals between Lewis, Gale, and Carilion in our system. It's wonderful.
Thank you, Madam Chair. Tara Durant, representing Senate District 27, which is most of the county of Stafford, the city of Fredericksburg, and portions of Spotsylvania County.
We will be joined shortly by Senator Bagby. We're going through introductions, Senator.
Is it my turn?
It's your turn.
Lamont Bagby, representing Henrico and Richmond.
Welcome.
Thank you.
Okay, there's a housekeeping matter before we start going through our regular agenda. And I'm going to move some bills or ask my colleagues to move bills, 3 bills in a block to be carried over for the week. So it would be Senate Bill 140, Senate Bill 390, and Senate Bill 392. We ask that those bills be passed by for the week. May I have a motion?
Second.
Okay, motion has been made and seconded. Will all those in support of that motion signify by saying aye? Aye. Okay. The chair heard a unanimous vote. Thank you, colleagues. In the subcommittee, all of our votes will be voice votes. We will not be up on the electronic board. That's it's an ongoing policy here. Okay, thank you for that. And the next bill is Senate Bill 154, and I believe Senator Head is here. Welcome.
Thank you very much. And we do have Senate Bill 154, which addresses Virginia's Advanced Directives Registry. The registry was initially established in 2008 to give a secure online central registry for advanced directives so that people could voluntarily submit the advanced directives and have it be accessed by healthcare professionals so that their healthcare decisions were going to be honored and that people had the opportunity to make those decisions in advance and they would be honored in the event that they were incapacitated or comatose or just unable to communicate. When it was enacted, the Advanced Directives Registry was limited to advanced directives, healthcare powers of attorney, and declarations of anatomical gifts. But what this bill seeks to do is expand the documents that are available for individuals to be able to voluntarily submit to the registry to include other documents that support healthcare planning, including durable do not resuscitate orders and portable medical order forms. It will also permit healthcare providers to access advanced care planning documents electronically for patients and just basically streamlines the whole process. That, in essence, is the bill, and I think there are some people here that might be able to weigh in a little bit more if you've got any questions or if you'd like to hear from any of them or if you have any questions. So.
Thank you, Senator. It's a very simple, direct, very understandable bill. I don't have any questions. I'll ask my colleagues. I don't see any. If you have speakers, you can ask them to come forward.
Anybody, there are some outside, if you need to hear from them, or if you don't.
I don't feel we need to hear from them. I think the bill is very self-explanatory. I will ask my colleagues if we want to move this bill along.
Madam Chair.
Senator Durant? Refer. You move to report and refer to the parent committee? Okay, motion has been made to report this bill and make a recommendation that this bill be reported by the full committee. All those in favor, need a second? Okay, all those in favor signify by saying aye. Aye. Okay, I heard unanimous consent. And what about Senator Suderling?
Also, by proxy.
By proxy, okay. Shall the clerk note that?
Ayes 5, no 0.
Thank you very much.
Thank you, Senator. Okay, I am going to go to Senator Williams Graves, and you have Senate Bill 525.
Thank you, Madam Chair. Senate Bill 525 is a bill that seeks to create a fund that would pay out per family up to $1,500 for families who experience a stillbirth to reimburse for qualified related expenses such as uncovered medical bills related to the stillbirth, funeral or disposal expenses, and any bereavement pay for any unpaid time off. A stillbirth is the death or loss of a pregnancy before or during delivery. Both miscarriage and stillbirth describe pregnancy loss, but they differ according to when the loss occurs. A miscarriage is a pregnancy loss before the 20th week of pregnancy, and a stillbirth is a pregnancy loss after 20 weeks of pregnancy. I believe it is important to note that a family who loses a child who is born alive and even draws one breath can claim that child on their tax return and receive financial support to cover some of the expenses associated with the delivery. Life insurance does not cover stillbirths. It generally does not kick in until 14 to 30 days after a child is born. And then lastly, families who experience stillbirth often feel abandoned and isolated. And so this $1,500 credit through this grant fund would be extremely helpful to them in recovering the costs of losing a child that they very much wanted and incurring costs that they did not intend to incur.
Thank you, Senator. Do you have any speakers?
I believe we have a couple.
Okay. Maybe they can come forward. This is a new grant program, is that correct? Okay. So did you submit a budget amendment for this? Yes. Okay. Welcome.
Good afternoon, everyone. I'm Candace Etnell, the Director of Birth and Color. This bill came about because we have so many stories from people who have suffered from stillbirth, and looking over their medical bills, they still get billed for the same amounts. And then when it comes to funeral costs and all of those type of things, it's extremely detrimental to think that these people aren't compassionate and like going through the same process as someone who actually went through a birth. And so we would ask that this bill be granted and move to the next committee.
Okay, thank you. Is there anybody else in the audience who wishes to speak to this bill? Please come forward.
Good afternoon, Madam Chair, members of the subcommittee. Jeff Caruso with the Virginia Catholic Conference. We also support the bill. Thank you.
Welcome.
Hello, it's appropriate that Virginia Interfaith Center for Public Policy would follow the Catholic Conference. Catherine Haynes, Health Equity Manager with the Virginia Interfaith Center. also a former practicing midwife. I know that carrying a pregnancy that may or will end in stillbirth can cause financial devastation for a family. We support.
Thank you.
Members of the committee, Madam Chairman, I'm Olivia Turner, President of the Virginia Society for Human Life, and we absolutely are grateful that this bill has been introduced because it is a compassionate thing to do and helps so many families in a very traumatic moment in their family journey. Thank you very much.
As I understand, the board would establish guidelines, so if this was income or other factors, the board would have the flexibility to establish those guidelines.
That is correct. And Madam Chair, I do apologize. I have an amendment with language. Sure. The amendment is an addition to line 21, where the sentence that ends with associated with such delivery, and we would wish to add as well as funeral or disposition expenses for the stillborn remains and lost wages from bereavement for employees without paid leave available for the time post stillbirth to be limited to 5 days.
Okay, a motion has been made to adopt the amendment. Is there a second?
Second.
Okay, all those in favor of adopting the amendment signify by saying aye. Aye. Okay, the amendment's adopted, so the amended bill is before us.
Thank you.
Madam Chair.
Senator Durant.
Thank you, Madam Chair. Thank you so much. Senator, it's if I'm not mistaken, this is a cap at $1,500 then?
That is correct.
Okay, thank you very much, Madam Chair.
Okay, I don't have any further questions at this time. Colleagues, do you have any questions? Go ahead. Senator Durant.
Madam Chair, I would move that the subcommittee recommend the full committee report and re-refer the bill to finance.
Second.
May I have to amend your motion a little bit. We're recommending that Ed and Health accept the report and that Ed and Health re-refer it to finance. Yeah. Okay, all right, just wanted to be clear. Is there a second to that?
Second.
Okay, there's a second. This is a voice vote, so there's a motion before us, and I'm going to go ahead and call for the vote. All those in favor signify by saying aye. 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 And is there an abstention? I'd like to abstain. Okay.
Ayes 4, no 0, 1 abstention.
Thank you.
Thank you. Let's see. We're moving along, colleagues. And I see Senator Rome is in front of us. Senator Rome, please come forward. And you've got two bills that I see.
Yes, Madam Chair. I'm happy to take either one first. So if you like, we can do SB 320.
Sure.
This is the WIC bill.
Okay.
All right, great. Thank you so much, Madam Chair, and to the members of the subcommittee. SB 320 is a bill that would direct the Department of Health to provide WIC information to food banks. WIC, that's the Women, Infants, and Children Program. This is a continuation of the work we did that passed the State and Senate 40-0 last year, and ensuring that information on existing programs regarding nutrition are accessible and available to the public. This bill will ensure that both resources and education to all food banks located within the Commonwealth regarding outreach opportunities for providing assistance to individuals completing an application for SNAP's WIC program. Additionally, I just want to also mention I was walking in and the Federation of Food Bank supports the legislation.
Okay, very good.
And I'll also note, Madam Chair, this is a Section 1 bill.
it's a Section 1 bill, and this will reach a broader range of folks than those who are just applying for human services in the Department of Human Services. So I appreciate that breadth. Do you have speakers or anybody that you want to bring forward?
Good afternoon, Madam Chair, members of the committee. Heidi Hertz, Cozen O'Connor, Public Strategies, representing No Kid Hungry, Virginia. We support the legislation. We've seen partnerships like this go a long way to increasing access to SNAP and communicating and educating families about that. I also represent the Virginia Agribusiness Council and the Virginia Food Access Coalition, of which the food banks are a partner, and we support the bill.
Question for the patron. I would expect that there's a budget amendment filed for this, and there's a fiscal impact with this.
Let me check for a second and consult with my. If you like to continue taking testimony, let me make sure that we have that.
And you can go ahead and check.
Madam Chair, members of the committee, Emily Moore with Voices for Virginia's Children. We also strongly support the bill. We have seen, again, how this has impacted our SNAP program and our Department of Social Services, and really look forward to being able to bridge that gap for access. Thank you.
Okay. Thank you.
Emily Hardy with Virginia Poverty Law Center, and we also support the bill, and we appreciate the senator for bringing it. WIC is an underutilized program, and all efforts to make sure that people are aware it exists are a benefit, and so we appreciate the senator for bringing this and ask that you pass it. Thank you.
Thank you.
Madam Chair, everything could be done administratively without additional funds, so there was no need for the budget amendment.
Okay, and of course we gain more children through the supplemental nutrition program or others. We will that's a separate topic. We can address that as well. Okay, the bill is before us, and I'd like a motion.
Move the report.
Okay, motion has been made that we recommend to Ed and Health that the bill be reported.
Second.
Okay, all those in favor, please signify by saying aye. Aye. The chair heard a unanimous vote. Is that correct? Okay, thank you, colleagues. It's a 5-0 vote.
Thank you, Madam Chair.
Coming out of the subcommittee. You want to go to 325?
Yes, please, Madam Chair. Madam Chair, I notice that we have a committee substitute. It's actually not that long, if you'd just like me to just read it to you.
Okay, and
all right. So, Madam Chair, this came as by a couple of requests from the agency and from clerks of court. So we just wanted to have a couple clarifying things in here. So now from lines 79 to 91, it will state as follows: Section F. Or I'm sorry, Section H. When a new certificate of birth is established pursuant to subdivision A1 and Romanet 1, at least one adoptive parent is an active duty or retired member of the military or military reserves, and Romanet 2, the filer notifies the clerk of court in writing that an adoptive parent has military status as required herein. The clerk of the court decreeing the adoption shall deliver the adoption records and a standardized confirmation of active duty or retired military or military reserves membership of either adoptive parent to the state registrar no less than 5 business days after receipt by such clerk of the final decree from the judge who entered such decree. The state registrar shall expedite the issuance of the new certificate of birth to the adoptive parents upon receipt of A, adoption records as provided for in 32.1-261, B, standardized notice from the court that finalized the adoption that at least one adoptive parent is an active duty or retired member of the military or military reserves, and C, a completed request to the Virginia Department of Health that a new certificate of birth for the registrant be prepared. Requirements set forth in 32.1-271, 32.1-272, and 32.1-273 shall apply to the disclosure of information or issuance of the adopted registrant's new certificate of birth. And Madam Chair, I'd just also like to note that I worked with Delegate Coiner in the House on this, who's carrying the cognate on this bill. And basically, long story short, is this was a problem that was basically meaning that you had infants and babies being waited to be adopted who are being left uninsured because TRICARE had not kicked in for them. And so the whole point of this was to try to expedite the whole paperwork and bureaucratic process of this so that we could get them under TRICARE insurance more quickly.
Okay. It sounds very reasonable. First, let me have a motion to adopt the substitute.
Second.
Okay. A motion has been made and seconded. All those in favor signify by saying aye. Aye. Okay. So the bill's before us in its substitute form, and we heard a thorough presentation from the patron. Do you have anybody who would like to speak to this bill?
I'll try to make this a little brief. Good afternoon, Madam Chairman and other senators of the subcommittee. My name is Joshua White. I'm a Virginia born and raised in Wise and Dixon County in Southwest Virginia. I'm a 20-year retired veteran of the U.S. Army. I've served in Iraq, Afghanistan, and Central America, just to name a few. I've been part of many units doing various jobs to include 6 Special Operations Group, Joint Task Force Bravo, and Task Force Tiger Shark. I currently reside in Prince George County, where I fill the role of a stay-at-home dad to my wife of 17 years and now 5 kids. I come to you today to testify to the importance of this bill. December 2022, I adopted my now oldest daughter, Harley White. I immediately, as the court documents were signed, I sent it off to Vital Records as required. As all new to you procedures come through, we stumbled a little bit, but we noticed it was about 3 weeks, and we still hadn't heard anything back. Through making some phone calls, talking to my attorney, said it could be up to 6 months before I could get a response back, depending on the delay in the court, getting it up there and coming back. When we went into the DEER's office, the ID card office, to enroll her, the federal government, which controls TRICARE, does not allow for the court document to be used as a source document. It has to be an original birth certificate. I immediately contacted the Pentagon for an exception to policy, and it was denied. It was not within their power. It would have to be a bill done on Capitol Hill. I happened to run into then Delegate Brewer, which is now Senator Jordan, and I talked to her. Her and her office called and immediately got the ball rolling a little bit faster than what it was. I do believe she's got some skin in the game when it comes to being adopted as well. So I contacted Vital Records right after that. They told me that her paperwork had been pulled from the stack and they'd get to it immediately. They said it'd be about a week. Within 3 days, it was back in my hands. The following business day, Harley was enrolled in DEER's. I don't know how long this process would have taken. If not, fortunately for us, we had no bad situations happening. I then ran into Delegate Courier and discussed this matter about getting a permanent fix for all adopted children of or military families that adopt children. And she started working on a House bill, then reached across the aisle to Senator Roll to get this bill. I hope that you support Senate Bill 325.
I think it's in good shape.
Okay.
I think it's in good
Very
shape.
good. I know I probably talked your ear off.
I want to give you some relief.
So, okay, well, thank you for allowing me to come to speak on this matter.
You are welcome.
Okay.
Do you have any other speakers? Mr. Pickrell.
Ma'am, just briefly, Madam Chair, members of the subcommittee, the Virginia League of Social Services Executives also supports the bill.
Okay, thank you. Okay, colleagues, the substitute is before us. Senator Durant.
Move to accept the substitute.
You move to report the substitute to
substitute,
the
thank you.
Education and Health Subcommittee and recommend that they report it out. Okay, that's the motion?
Second.
Okay. Motion has been made and seconded. All those who want to support the motion signify by saying aye. Aye. Is anybody wishing to abstain or vote no? Okay, your bill will be recommended for report out of Ed and Health.
Thank you, Madam
By
Chair.
5 to
Thank you to
0.
the members. And thank you also
Thank
to the folks who testified today. We really appreciate it.
Thank you. Yes, Senator Hashman? Yes, you're next, and you're the last. If you don't mind, I took the others first. Okay. Okay. Colleagues, I would ask you to draw your attention to Senate Bill 250. Senator Hashmi will be presenting.
Thank you, Madam Chair. Members of the committee, SB 250 is seeking to address the crisis of maternal mortality that we have in Virginia. Maternal mortality rates in Virginia are sadly lagging far behind the rates of many other states. And this is an issue, as you know, that we have tried to address in several ways here in Virginia. And I'm hopeful that this bill will help us in one sense to begin to address the issues of high-risk pregnancies, particularly for those individuals who do not have the opportunity or the ability to get regular prenatal screening and prenatal care that would address some of the health issues that cause these disproportionate rates. So just quickly, this bill clarifies how our current CPT codes for ultrasound and non-stress tests can be billed when a patient is remote and the same standard of care is met. And so SB 250 is really deploying a remarkable new technology that is now available that allows for physicians caring for pregnant individuals to provide the technology to do ultrasound and non-stress fetal tests at home. Rather than coming into a clinic or into a hospital, and that data then is transmitted to the physician or the clinician that's caring for that patient. This helps so many individuals identify when they are facing issues of concern. I myself have had 2 high-risk pregnancies. I was on bed rest for 3 or 4 months for both of them, and my doctor said, you can't even walk to the bathroom, basically. That was a limitation, not supposed to move. And yet every week I had to go into the hospital. I had to go to my car. I had to drive, park in the hospital, walk upstairs. That caused significant stress just going to get my non-stress test and my ultrasound. So imagine the kind of care and continuity of care that we can provide to those individuals when they are facing high-risk pregnancies for whatever medical conditions they may have, that they are able to safely from their home address those issues. And this also impacts our rural patients who don't have access to clinics. They're able to save the time from driving from home to a clinic or from work to a clinic, and really continue to get the kind of care that they need with a medical provider that is able to watch them effectively. So this bill clarifies how the existing services can be offered. It doesn't create any new services, but it will increase care compliance that we have for individuals that need prescribed ultrasounds. And I think this is going to be a tremendous benefit and hopefully help us to address those maternal mortality rates that we see in Virginia. And have a gentleman here to speak to the technology in particular.
Thank you, Senator Hashmi. Would you like to address the committee?
Thank you. Hi, everybody. My name is Evan Hoffman. I am the Director of State Government Affairs for Phillips and a Loudoun County resident, so thank you for having me here today. For those who aren't aware, Phillips, we're a healthcare technology company. Many people know us for our Sonicare toothbrushes, but we're also one of the world's largest maternal health technology companies and have been for decades. We're the global leader in ultrasound and obstetrics monitoring. Interestingly, we also have the world's most downloaded pregnancy app called Pregnancy Plus, which 55% of Virginia women who were pregnant used last year. So we're really trying to make a difference here in Virginia with prenatal care. As mentioned, this bill is super important because it will unlock more maternal health care options for any Virginian who struggles to access care and their provider, using their discretion, deems that remote care is an adequate way to receive that care. Many moms face that impossible choice of trying to make other prenatal care appointments, as you mentioned. But even if they don't live far from their doctors, others perhaps can't take off work easily. Others might lack reliable access to transportation, can't find childcare for other kids. So there are lots of use cases where remote maternal health technology can make a difference. And if you've never seen tele-ultrasound before, you can literally take an ultrasound wand, you can plug it into a smartphone or a tablet, and you can bring ultrasound into someone's home with that provider, of course, who's kind of coaching and quarterbacking the whole thing. But that provider could really be anywhere in the world. Same with the non-stress test. So this is relatively novel technology. The FDA has been approving this over the last few years. And this bill simply seeks to make that care accessible if it's the right choice by that doctor for their patient and in-person care isn't deemed critical. This is becoming more commonplace. Ohio, Missouri, Pennsylvania, and Georgia passed similar laws last year. The National Governors Association Maternal Health Playbook is urging every single state to cover remote ultrasound, remote non-stress tests as a way to deliver better prenatal care. So with that, we thank you.
Thank you. That was a very complete presentation. I think this is a wonderful bill, and it's going to, I think, reduce the care of reduce the cost of prenatal care is what I meant to say. And for so many folks who have had transportation issues or other barriers to getting prenatal care, this removes those barriers. So I think this is wonderful. And my question, a provision for payment of medical assistance. So to reimburse patients, the medical assistance, would it cover all insurance companies or just Medicaid?
We have Mr. Frank here from DMAS
Yes,
who might be able to answer some
Mr.
questions.
Frank.
Madam Chair, Will Frank with DMAS. We are currently looking at this bill and how it kind of connects to what we already cover.
Right.
So we're still kind of looking at this in the pieces, but we look forward to continuing the conversation with the senator and her staff as this bill moves forward.
Yeah, I think this bill should move forward, and you should continue to evaluate our plans with our Medicaid contract providers. I know we have expanded the ability to cover virtual services in our Medicaid plans, so
correct.
This would fit right in.
Thank you.
Sort of. Okay, colleagues, the bill is before us. May I have a motion?
Move to recommend reporting.
Okay. Motion has been made that we recommend to the Parent Committee, Education and Health, that this bill be reported out.
Second.
Okay, and there's a second. All those in favor, please signify by saying aye.
Aye.
Aye. And of course, that's unanimous. It's a 5-0 vote. Okay, colleagues, this concludes our agenda for today, but we will be meeting, I believe, next Thursday, because we do have more bills we have to go through. Same time, and would we not be in the same room? I guess I'm asking our clerks.
Moving to Thursday. Today's Tuesday.
I wasn't thinking I had to.
I would guess we would stay on Tuesday because then House meets on Thursday morning.
I want to, you're staying today, so same time, same place.
So next Tuesday.
Correct, 4 o'clock, right here. Before we conclude, I do want to give our staff an opportunity to introduce themselves. Julia.
Julia Carlton with the Division of Legislative Services.
Hannah Yates with the Division of Legislative Services. Madison O'Dallo with the Senate Clerk's Office.
Alexander Chapman with the Senate Clerk's Office. And Hobie Lehman with the Senate Clerk's Office.
Thank you. And you're with the Legislative Services?
Yes, Julia Bergamini with Division of Legislative Services.
Oh, so nice to meet you. I just see your names come up on my LIS system. It's nice to see you in person. Okay, there's nothing more to come before the committee. Motion has been made and seconded. All those in favor signify by saying aye. Aye. The meeting's adjourned.
The Senate of Virginia, Richmond, Virginia.